What is going on, beautiful people? This is Medicosis Perfectionalis, where medicine makes perfect sense. Today we're starting a new playlist, microbiology, step-by-step comprehensive discussion. So let's dive into the world of microscopic organisms. The field of microbiology deals with bacteria, fungi, and viruses. The field of medical parasitology cares about parasites. This microbiology playlist is for the detailed explanation. If you want quick reviews, check out my playlist called Picmonic Medicosis. So far, this playlist has 6 microbiology videos. In the first video, we talked about these bacteria. In the second one here, third one here, and fourth, plus 5 and 6. If you want the quick review. Now let's get started. First of all, there is a big difference between microbiology and medical microbiology. Even the textbooks are different. This is intended more for biology teachers and biology students, but this is for medical students and doctors. The difference between them is so stark, it's not even funny. Microbiology is like learning the Bernoulli equation. Medical microbiology, on the other hand, is like learning how to fly a freaking airplane. This playlist is dealing with medical microbiology. We're concerned with diseases here, not counting the freaking amino acids. Okay, Medicosis, you will talk about medical microbiology. Will you talk about general or systemic? Unfortunately, most, if not all, professors start with general microbiology, and they make their students hate themselves. They start by telling you how to culture bacteria without telling you why the flip would you culture them. They tell you how your immune system can protect you. Well, protect me from what? They tell you about the diagnostic tests before talking to you about the disease. This is just a stupid way of teaching. Medicosis is going to start with systemic microbiology. The first order of business is to make you love bacteria, learn about disease, adore these stories. And after we finish talking about individual bacteria and the diseases caused by each one, then we can review the general, and then I'll talk to you about the difference between endotoxin, exotoxin, all of this lovely stuff. So besides the first few videos, I'll start going to Staph aureus right away. But hey, Medicosis, Staph aureus can secrete enterotoxin, but you haven't told me what enterotoxin is. When we go to Staph and you hear the word enterotoxin, it's my job to tell you what the enterotoxin is and what's the difference between endo and exotoxin, all of this lovely stuff. But you have to learn them in context, not in some ugly, nonsensical, abstract tables that make you have watery diarrhea. No pun intended. Microbiology is the study of small life, microscopic organisms. What microbes are we talking about? Bacteria, fungi, viruses, and parasites. Technically, parasites should not belong in the science of microbiology because micro means microscopic. Parasites could be huge. For example, the Ascaris, the Ancylostoma, these are very long worms. They are not microscopic by any stretch of the imagination. So lumping them together here is just to make it easier for you. But if you want the technical stuff, this belongs to a different science known as parasitology. Now please pay attention because this is a very common source of confusion. There is a difference between a parasite that can affect humans, causing these parasitic infestations, and parasitic behavior. Because according to your woke biology professor, anything that lives in your body, taking its resources, is, quote, a parasite, unquote. For example, the virus can hijack your nucleus. In this sense, the virus is a parasite, but this is not the same thing as parasites from the perspective of medical parasitology. Big difference. That's why this playlist is about medical microbiology. Therefore, we have bacteriology, fungology or mycology, virology, and parasitology. Nomenclature time: kingdom, phylum, class, order, family, genus, species. When I write Staph aureus like this, Staph is the genus, aureus is the species. Do not write Staph like this. You should write them in italics. Write Staph like this. When the name is written in italics, it could be bacteria, fungi, or parasites. Viruses are not written in italics because the issue of viruses is a special situation. Viruses are not even living organisms. Ergo, when I write the word Haemophilus influenzae like this, it has a totally different meaning from writing influenza like this. The first one is in italics. The second one is erect. It's not italics. The first one is a bacteria, the second one is a virus. Huge difference. Let's try an example. We start with the domain. In this case, it's a bacteria. After the domain, there's the kingdom. All right? After this, there is the phylum. We're talking about Proteobacterium, just as an example. After this, you go to the class. Are you alpha, beta, or gamma? Well, I'm gamma Proteobacterium. All right. Now, there are many of these gamma Proteobacterium. Which order? We are the Enterobacteriales, and the word entero means gut, GI tract. And then what's the family? We are the Enterobacteriaceae. Wow. And what's your genus? Shigella. What's the species? Sony. So, therefore, from a medical standpoint, we only care about the last two, the genus and the species, and therefore, my friend, unfortunately, you have Shigella sony. What does that cause? Well, remember, it's part of the entero, so it causes gastrointestinal symptoms. What do you mean? Usually diarrhea. Watery diarrhea or bloody diarrhea? Bloody diarrhea. I can write Shigella sony like this. I can write S. sony like this. The first one has to be capital. The second one is small. Uppercase, followed by the lowercase. Uppercase for the genus, lowercase for the species. Or if the doctor doesn't know that it is sony per se, the doctor can write it as Shigella species, like this. If we do not learn from history, we are doomed to repeat it, baby. Brief history of microbiology. First, Mr. Zacharias Janssen. First, compound microscopy. I will give you 9 times magnification as compared to your naked eye. Then, circa 1665, Robert Hooke. He saw cells under the microscope, and he called these cells boxes because, yeah, they live together like this, and they look like a bunch of boxes. And then my student, Antony van Leeuwenhoek, saw the first living microorganisms, but he did not call them microorganisms, he just called them animalcules. Oh, it's like an animal cell and a small one. It's like the difference between node and nodule, moon and moonlet. Animal cell versus animalcules. Next, Monsieur Louis Pasteur said these are microorganisms and you can find them in the air. Really? Yeah, really. He also introduced the concept of pasteurization and inoculation. And then John Tyndall and Ferdinand Cohen discovered that some microorganisms are heat resistant, which means you cannot kill them by simply cooking the food. Here is my man Antony van Leeuwenhoek. He saw a lumen in the center of the cell. This is what we now call the nucleus of the cell. And based on this, we classify organisms into prokaryotes and eukaryotes. The word karyo means karyon, which is the nucleus. I have a primitive nucleus versus I have the true nucleus. Bacteria are here. Humans are here. And then Robert discovered that you can get anthrax by ingesting contaminated animal meat. Also, you can inhale a spore from somewhere near the animal and you can get anthrax too. This was followed by Joseph Lister and his antiseptic techniques. Oh, by the way, the famous mouthwash brand Listerine is named after Joseph Lister. I bet you the CEO of this company doesn't even know this. Man, these corporate chills. I'm just joking. History is full of diseases that devastated individuals, communities, villages, whole countries, even an entire continent. Case in point, Yersinia pestis, which causes the Black Plague. Vibrio cholera, which causes cholera, watery diarrhea, and vomiting. It is severe watery diarrhea. It can kill you from volume depletion. Many mothers unfortunately died during childbirth because of puerperal sepsis, which we now call peripartum sepsis. But this was about to change, at least partially, by a wonderful person known as Sir Alexander Fleming. He was sick and tired of being sick and tired, and he said, you know what, I'm gonna close this lab, I'm going on vacation. He went on vacation, had great time with the wifey, but when he came back, he discovered something. He left the window open. Oh, some stuff entered from the window to his lab, landed on the culture of the bacteria, and he found that half of the dish is empty of bacteria. What? Where did the bacteria go? Well, Maybe something killed it. Where did that come from? Oh, maybe it's from the window. What's the nature of that thing? It was a fungus known as Penicillium notatum. Therefore, he called this penicillin. He threw a wedge into the intergluteal cleft of history. There is history before penicillin, and there is history after penicillin.
But hey, Medicosis, he was just lucky.
The harder I work, the luckier I get. Experience favors the mind prepared. Penicillium notatum has been around for millennia. Only Alexander Fleming picked it up. In your practice, you will see two doctors who saw the same patient, took the same history, performed the same physical exam, but one doctor was able to arrive at the correct diagnosis, the other doofus just kept ordering tests and reordering tests and reordering tests, even though it was the same patient. Experience favors the mind prepared. You know, if one of these old diseases like leprosy or the plague came and infected a patient and this patient came to the hospital, I can guarantee you almost all of the doctors will miss the diagnosis, except he who has his mind prepared, he who is ready for the extremely unlikely circumstances. How do we classify bacteria from a medical standpoint? By the gram stain. The G has to be capital because this is the name of a scientist. At least have some respect for yourself. We have gram-positive bacteria and gram-negative bacteria. Gram-positive appear as purple. Gram-negative appear as pink under the microscope. And then the gram-positive are divided into two subtypes. Same with the gram-negative. I could be purple and spherical. Now I'm called a coccus. Or I could be purple and elongated like this, cigar-shaped. We call you a rod or a bacillus. Same thing with the gram-negative. So therefore we have gram-positive cocci, gram-positive rods, gram-negative cocci, and gram-negative rods. Next, a beautiful love story in microbiology. The story of the wifey and her hubby. Both were microbiologists. Fanny suggested to her husband, "Hey doofus, why don't we use agar instead of gelatin as a medium to culture the bacteria?" Because Walter, tried everything as a medium for culture. He tried gelatin. He even tried freaking potato chips until his wife told him, "Try agar, it's more stable," and she made history. Experience favors the mind prepared. And as Dr. Thomas Sowell said, it doesn't matter how smart you are until you stop and think. Some bacteria can make spores, others cannot make spores. Please be careful. Only the gram-positive are capable of making spores. Gram-negatives cannot make spores. Moreover, not only the gram-positives, only some of the gram-positive can make spores some of the time. So if I ever hear you utter the following sentence,
"This is a gram-negative spore forming,"
shut the French toast up. There is no such thing as a gram-negative spore-forming bacteria. If you're gram-negative, by definition, you cannot make a spore. There is another way of classifying things based on the position of a certain enzyme. For example, gram-positive cocci could be classified into staph versus strep. Based on what? Well, do you have the catalase enzyme? Yes, said the staph. No, said the strep. What is the difference between cells and viruses? Well, cells, these are living cells. Viruses are not considered as living organisms. They are considered particles or non-living particles because they live on the edge between the living and the non-living. Viruses are weird. Cells can replicate by mitosis or binary fission, but viral particles, nope, we're not doing this. Cells have cell membrane in every cell. Viruses, nope, I do not want your cell membrane. I might have an envelope, I might lack an envelope. Your cell has DNA and RNA, but viruses, no, I choose one. I'm either a DNA virus or RNA virus, not both. Cells have many proteins. Viruses have few proteins. Cells have ribosomes. Viruses do not have ribosomes, with only one exception. Cells have mitochondria in some cases, if you are a eukaryote, but prokaryotes do not have mitochondria. Therefore, do not tell me, "Oh, the electron transport chain was robust in the Staph aureus bacteria." What are you talking about? Why are you drowning in contradictions? If it's a bacteria, it's prokaryote, it does not have a mitochondria, ergo, no electron transport chain, no oxidative phosphorylation, no TCA or Krebs cycle. But viruses, no, we want nothing of your world. Cells have many enzymes. Don't forget enzymes are proteins, but viruses have few proteins and therefore few enzymes. Next, bacteria versus humans. Bacteria, prokaryote, humans, eukaryote. Do you have a cell wall? No, I do not have a cell wall, but bacteria do have a cell wall. Do you have a cell membrane? Sure, I do have a cell membrane. So does the bacterium. Cell membrane is the same as plasma membrane, the same as cytoplasmic membrane. Don't you ever forget that you lack cell walls, but bacteria do possess a cell wall.
Why should I care?
Because of the fact that you do not have a cell wall, and the bacteria do have a cell wall, some medications, like the beta-lactam antibiotics, example, penicillin, can kill the bacteria without killing you.
Why?
Because these are cell wall synthesis inhibitors. They go to the bacteria and destroy her cell wall. They prevent the formation of her cell wall. The bacteria will die. But since you do not have a cell wall, penicillin will not kill you by inhibiting cell wall synthesis. It can kill a very minute percentage of patients because of an anaphylactic reaction, but that's a story for another time. Penicillin can kill the bacteria, yes, but it cannot kill you because you do not have a cell wall, but the bacterium does. The bacteria are sneaky, man. They can evade your defense systems. They can evade your immunity. How come? Many mechanisms. For example, Staph aureus has the enzyme known as coagulase. What does coagulase do? It's an enzyme, ACE, that can coagulate. What does that mean? Convert fibrinogen, that's your fibrinogen, into fibrin in your own body. And now the bacteria is surrounded by fibers. These fibers will protect the bacteria from your own white blood cells, from your own immune system. Next, the presence of the coat known as glycocalyx, which literally means sugar coat, or carbohydrate coat, prevents the bacteria from being eaten and phagocytosed by your phagocytic cells, like the macrophage. In addition, some bacteria have a capsule, encapsulated, like the shin. What's the S? Streptococcus pneumoniae. What's the HI? Haemophilus influenza. It's in italics, baby. It's a bacteria. That's not the influenza virus. Pay attention. And N. Neisseria meningitidis. These are encapsulated organisms. Therefore, they can protect themselves from phagocytosis. Next, some bacteria, such as Rickettsia, can hide in your cytoplasm, but they will not hide inside the lysosome. They will hide outside the lysosome, away from the lysozymes in the lysosome. What does lyso mean? Lysis, destruction, breakdown. What does so mean? Soma means body. That's why we have the somatic nervous system. That's why the nerve cell, the neuron, had what? A cell body. It was called the soma. Remember? That's the lysosome. Inside this lysosome, this body of destruction, what do we have inside? Destructive enzymes, lysozymes. What does zyme mean? It means enzyme. Pardon me. It means an active enzyme. Because if I want to write inactive enzyme, I will write zymogen, because it causes genesis to the enzyme. So when you see zyme, it means active enzyme. Inside the lysosome, we have active enzymes. They can burn the bacteria. But the bacteria is sneaky. I'm going to hide outside. Moreover, bacteria like Bacillus anthracis can neutralize your lysozymes.
You're so proud of your lysozymes?
I'm going to make them inactive. Hashtag neutralization. In order for the lysosome to work, this lysosome, the ball of destruction, has to be combined with the target that we want to destroy. The lysosome has to bind to the phagosome, but some bacteria, such as Salmonella, prevent the fusion of the phagosome with the lysosome. You will not kill me. What else? Tuberculosis has a virulent factor known as the code factor. It also prevents the fusion of phagosome with lysosome. That's how you end up with tuberculosis. What's the name of the bacteria? Mycobacterium tuberculosis, formerly known as TB bacilli. What's the name of the disease? Tuberculosis. In my lungs, it's called pulmonary tuberculosis. Last but not least, some bacteria can secrete leukocidins. I love the name. What does the IN mean? It means protein. The S is just for plural. Mostly, if you end in IN, you're a protein, with few exceptions like heparin, for example. It ends in IN, but it's not a protein. Anyway, leuco means what? White. We're referring to your white blood cells, okay? What does side mean? Side means kill, e.g. homicide, suicide, infanticide. Leukocyte is what? Is to destroy your own leukocytes. I will kill your immune cells. I will take you to the cleaners, said the tiny microscopic prokaryote. If you remember my video on tuberculosis, which was in my pulmonology playlist, we talked about the cord factor, which is the virulence factor. It's a protein. It impairs the fusion of phagosome with lysosome, and that's how the Mycobacterium tuberculosis invade your lungs. If you like this video, you will fall in love with my antibiotics course. It comes with 40 videos, questions, and cases. Go to medicosisperfectionalis.com to download it today. No subscription needed. You download it once and you keep it for you forever. And for a limited time, you can get a 30% discount by using promo code PANCREAS. Thank you for watching. Please subscribe, hit the bell, and click on the join button. You can support me here or here. Go to my website to download my courses. Be safe, stay happy, study hard. This is Medicosis Perfectionalis, where medicine makes perfect sense.